Hi, I'm Keisha Lewis, occupational therapist and certified diabetes care and education specialist. And thanks for tuning into the channel. I took a little bit of a break, but I'm back. So if this is your first time here, remember like, share, and subscribe, or I should say don't forget to like, share, and subscribe. If this is your second time or more, don't forget to share. So in June, we acknowledge Men's Health Month. And today we're going to focus on what every man and family needs to know and how diabetes affects men differently and what we can actually do about it, or what you men can do about it. So here's a fact that a lot of people don't know. Men are more likely to develop type 2 diabetes at a lower weight than women. And that's because men tend to carry more abdominal or that belly fat. And that's the kind of fat that's a major risk factor for insulin resistance, meaning our body can't use that insulin as well as it should. The tricky part is that many men don't experience notable symptoms at first, or you men delay going to the doctor. That means that diabetes may go undiagnosed until complications start to show up. So for you, it's worth checking. If you've gained weight around the middle, you feel more tired than usual, you're urinating a lot, or you're just not feeling like yourself. When diabetes isn't diagnosed and managed, it can cause a lot of complications, and that's what I want to prevent. Diabetes can affect your whole body, and when it's not managed, it can increase your risk of things like heart disease, stroke, vision problems, kidney failure, and even amputation. So it's really important that you take this serious, fellas. Complications that are unique to men, they often hit below the belt. And I mean literally, fellas, below the belt. This can include erectile dysfunction. You know, men with diabetes are 3 times more likely to have erectile dysfunction. I will say that 95% of cases are treatable. And then there's overactive bladder or incontinence, which can cause frequent urination at night. Men also experience frequent urinary tract infections. And I want you to know that these issues are common, but many men are less likely to talk about these sexual health issues. But the good news is these problems can be treated. These complications can be prevented or managed with early detection and the right support. So that's why I'm talking about it today. If you're experiencing these problems, it's a sign that you need to change how you're managing your diabetes. Complications are a sign that blood sugars are too high. So I want you to know, what can you do about it? So when you finish listening today, what steps can you take? We're going to talk about some prevention and early action that you can leave today and you can start. The first thing I want you to do is know your risk. So visit the link in the comments section to take you directly to the American Diabetes Association Risk Factor Assessment. It will literally only take you about 60 seconds or less to complete. If you're over 45, you're overweight, physically inactive, or if diabetes runs in your family, I also want you to ask your doctor about taking a fasting blood sugar test or getting your hemoglobin A1C done. Taking proactive steps and identifying your risk before symptoms starts is really important. And then I want you to take these small but powerful steps. I want you to work on eating balanced meals. And to learn more about balanced meals, schedule an appointment with the registered dietitian. Then I want you to get moving. The recommended physical activity is at least 150 minutes a week. But if you can't do that, try being active for 10 minutes after eating breakfast, lunch, and dinner. This can add up. And the important thing is that all movement matters, and it can really make a difference to help move you in the right direction. Then I want you to prioritize sleep and stress management. This all plays a role in helping you manage your diabetes. And lastly, follow up with your healthcare provider for your annual physical. And if you don't have a healthcare provider, locate one and make an appointment. If you need support, you don't have to do this alone. Reach out to your support systems, your family, your friends, your healthcare providers. And then there's Welldom. So at Welldom, I offer one-on-one diabetes coaching that's customized just for you. No judgment here. There's no one-size-fits-all plan, just real support to help you stay ahead of the game and protect your health. Because what I'm trying to do is prevent those complications. So fellas, your health matters. And if you're watching this for a partner, father, brother, or friend, I want you to share this video. I want you to start the conversation and help them take the first steps towards better health as we close out Men's Health Month. Don't wait for complications to start. I want you to take control today. So check out the link below to learn more about how Welldom can help you or someone you know manage diabetes with confidence. So thanks for watching. I'll see you in about 2 weeks. And I want you to remember, let's take care of each other and most importantly, take care of yourself. I want to know in the comments what other topics you want to discuss in the coming weeks. And don't forget to like, share, and subscribe. And don't forget, use the link in the description and the comments to take that diabetes risk assessment if you don't know your risk. It can really make a difference. Thanks everyone for watching and have a fabulous week.